Good day. I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. On behalf of Padma Clinic and Nursing Home, Chennai, as a part of the continuing medical education program, as well as the health awareness program for the public being organized by Padma Clinic and Nursing Home, I am speaking today on facets on epilepsy. And this is part 5 at the broad concepts of anticonvulsants or anti-epileptic drugs which we give for patients with epilepsy or suffering with epilepsy. The main aim of the treatment for anti-epileptic drugs when you give is one, complete freedom of the seizures. The second one is avoidance of negative effects on the cognitive function, on the emotional, physical or the general well-being. These are the two aims of the treatment for the with anti-epileptic drugs for epilepsy, and this has been pointed out very well by an author on Postgraduate in Medical Journal 2004. Now, any doctor for that matter, a neurologist and a neurosurgeon will always look into which is the best anticonvulsant that we can give for this patient. It will be tailor-made for each patient. But when you think about it, an ideal anti-epileptic drug, what exactly it is? One, it should have a broad spectrum activity against all the seizure types. That is one. Second, highly efficacious. 3, good tolerability. 4, no risk or allergic or idiosyncratic reactions. 4, low interaction potential. 5, a favorable pharmacokinetics, a linear kinetics or a half-life should be compatible so that in such a way you can give the medication one morning, one night. Low and no tolerance to anti-epileptic effects, no withdrawal of seizures, no need for intensive lab monitoring, availability of convenient formulations, pediatric and parenteral, low cost. So, these are all the ideal properties of an anticonvulsant what we look into. But many of the times it is very, very difficult to find out with all these properties an ideal anti-epileptic drug. Now, some of the anti-epileptic drugs which had been there much earlier, which I would like to tell, they are one, phenobarbital, which is just described as early as 1912, phenytoin 1938, primidone 1952, ethosuximide 1960, carbamazepine 1974 and valproate 1978. So, phenobarbital has been given for generalized seizures, phenytoin has been given for generalized seizures, primidone 2, ethosuximide for absent seizures, carbamazepine has been given for again complex partial seizures and valproate for generalized tonic-clonic seizures. Now, each one of these have got indications, they too have side effects also. Despite a broad range of whatever anticonvulsants that I have told you or that is available, you find 30% of patients with epilepsy are uncontrolled with the available treatment, and further a 25% suffer from various manifestations of the drug toxicity. This has been pointed out in the Journal on Epilepsy in 2005. Now, there are a lot of newer anti-epileptic drugs that have come. They are equally as effective as older AEDs, it has been found. Better tolerated also than the earlier anti-epileptic drugs. And they have fewer interactions when they compare the drug-drug interactions. But they are expensive compared to the older drugs. Now, just let us see the newer drugs that have come into the market. Felbamate in 1993, gabapentin in 1993, lamotrigine in 1994, topiramate in 1996, tiagabine in 1998, levetiracetam in 1999, oxcarbazepine 2000, sodizamide 2000, pregabalin 2005, lacosamide 2008, azilcarbazepine 2009, vigabatrin 2009, rufinamide 2010, clobazam, a short-acting drug 2011, and retigabin in 2011. These are some of the drugs that in fact have come into, and we also know breviracetam which has also come into the market. So, felbamate, gabapentin, lamotrigine, topiramate, vigabatrin, levetiracetam, oxcarbazepine, sonizumab, pregabalin, lacosamide, rufinamide, clobazam, Izilcarbazepine and retigabine. These are the various drugs that have come into the market. These drugs, majority of them, we are giving it as add-on, excepting maybe levetiracetam, lacosamide, then vigabatrin. These are some things, the primary or the first drug of choice. Oxcarbazepine, all these are the first drugs of choice. Oxcarbazepine we give for complex partial seizures. Levetiracetam can be given as a primary drug for all forms of seizures, including generalized tonic-clonic seizures. And vigabatrin, of course, being given for patients who have West syndrome. And clobazam is a short-acting drug. So these are the, of all these newer drugs, these are the ones that are more commonly being used. That's in brief on the anticonvulsants, the ideal properties of an anticonvulsant, as well as the newer anticonvulsants that have come into the market in the last few years I have highlighted to you. Thank you very much.